Mary, what has chiropractic care like been during your pregnancy?
It's been amazing. It's been really helpful with less aches and pains, and being a little bit more comfortable during pregnancy.
So, Nicole is just finishing up on a shockwave session for Mary. Mary's in her second trimester of pregnancy, and she just came off working 7 days in a row, 12-hour days, standing a lot. There's a lot more fluid, especially our extremities get a little tighter. Sometimes our pregnant population, they complain of like carpal tunnel syndrome, numbness and tingling in the hands, achiness in the feet. So what's happened with Mary is she's getting muscle cramps at night, charley horses, and she's got pretty significant tension trigger points. And so when we're dealing with anything that's a little bit more significant, it requires a little bit more work. I use dry needling in the acute sense for this type of a problem, but I also use shockwave. This is radial shockwave, and Nicole is spending time on each trigger point with a certain applicator or tip, and she's applying pressure and percussive shock waves into that tissue, which will help with muscle tonicity or spasms. Okay, so long story short, she's using a really great tool in the form of radial shockwave to reduce tension in charley horses in her calves, and I'll follow up with some soft tissue work on her calf, which you'll see in a second. Prior to doing this intense treatment, I did a little bit of work on her feet and her calves, and then I had Nicole. Nicole, would you mind pulling out that other applicator? It's okay. This is just a nice way. There's different versions of. Did you use Atlas tip from the beginning? Okay, so you use that percussive device.
Yeah.
So that's one version, and then that little mouse-looking thing on the left-hand side is another version where you can create. Like you desensitize tissue. So people are like, I'm hurting. I don't want that on me, right? Sometimes we just got to get things warmed up a little bit and get our body accustomed to touch, pressure, and that kind of force. And that tool on the left does that for us. So you don't need to wipe it up. It's okay. Yeah. I'm going to come in just on the side and just do some passes, and I'll show you some flash release. And I'll ask Mary some questions about chiropractic care. This type of care, right, through pregnancy, what it's been like for her. Cool, come on in. Mary, what has chiropractic care like been during your pregnancy?
It's been amazing. It's been really helpful with less aches and pains, and being a little bit more comfortable during pregnancy.
So I'm like, I'm so used to having going through the last 6 years, seeing a lot of perinatal care, and also treating my wife through the pregnancies that we've had. So it's something that's I'm accustomed to. For a lot of people, I would imagine, and what I've heard is that they're afraid of getting adjusted during pregnancy because they're afraid of the risks associated with getting adjusted, or just being something that they don't want to have to get tolerated while they're pregnant. What would you say to that as it relates to kind of physically getting moved around during pregnancy?
I think it's definitely worth the fear of it first, because I think that's more fear than anything, but the adjustment helps you cope with pregnancy a lot easier, because the aches and pains that you don't realize that your body goes through as your baby is stretching and as you're moving around, it really helps you sleep better, it helps you move a lot easier, and also your movements are more precise. They're not like you're not leaning one end to another, and so I would definitely say it's definitely worth it. It's definitely worth the adjustment, like the daily adjustment.
Yeah. So Mary's gotten a combination of care here. Go ahead and point your toes towards Carly, and then bring your toes to your shin. Yeah, just like that, nice and easy. Don't work it too hard. Just go slow and point gently, and then bring your toes to your shin. You okay with that? And point. And toes to the chin. She's also seen in the second trimester the massage therapist, periodically every 2-3 weeks, and we've been focused on reducing symptoms of sciatica for her pregnancy, as well as back and bilateral hip pain. And we've had good results relative to all those areas, and now we're just kind of maintaining those results periodically with her, right, as we finish up her treatment plan with us. And really just focus on trying to create as healthy of a pregnancy as possible as it relates to her feeling good, moving often. One thing we really advocate for is a lot of strength training during pregnancy, especially on the front end. So by the end of it, they're still able to kind of maintain good function and form. She's so busy, so active right now with work and running and operating a business that she has. It's the opposite of what she needs, right? She needs time to recover and rest and really relax in here. So that's our direction with her. When she comes in, that's based off her goals as well as my experience with this problem. Pressure okay?
Pressure's good.
So is point. And then come back up. Nice. So I work with local OBGYN groups at St. Joe's, some GBMC that send over their patients that have back pain or sciatica. It's oftentimes a window relative to it. Sometimes we see people that have patients that have round ligament pain, psoas, tightness, tension. Oftentimes from second to third and beginning of third, because the baby grows so much during that time, patients complain of lateral hip or glute med pain, so the edges of their hips are just achy. You doing okay?
I'm okay.
All right. Don't want to ignore you down here, okay? Point your toe. Bring your toes to your shin. Point your toe. So if we can give her that extra couple hours of sleep because her calves aren't cramping up in the middle of the night, if we can give her relief to actually fall asleep at night because she's not getting sciatica and back pain as significantly and she's getting better rest, that's a healthier pregnancy, right? If she's doing more in terms of movement and staying with her routine of healthy exercise, activities, work, right? Being productive at work, not feeling like she can't show up where it's becoming burdensome for her body to be there. I mean, 7 days in a row, that's a different story. It's a little different story. All right, we get it. You got to do what you got to do. Yeah, I hear you. A lot of pressure here. So it's a healthier pregnancy, right? Like, so that's what we're focused on with her at this point now that the pain's starting to calm down a little bit more. And this is a newer thing that's cropped up with her in the last month. Would you say it's new in the last month, or you just didn't tell me about it as much?
I think it's been worse the last month.
Okay.
At first it was just once in a while, but now it's been like a daily thing.
Has it? Oh, awesome. I'm excited to see how we help you with this. Okay. Stuff. All right. Nicole's awesome. You saw her doing the shockwave in here. She did a great job of really kind of following those trigger points and reducing a little bit of the tension. I was able to get in there with a ton of pressure, which is a great start, and create some flexibility in it after she had the shockwave, which I think is a great tool. And then, yeah, she's all set to go. So she's already been adjusted. Your low back, your mid back. We worked on your hips a little bit too. And if you are, sorry, you're like,
I think I should.
I know how to pull these back. I'm just good at adjusting people. That's the only thing I'm good for. My daughters do not run to me when they have stuff stuck in their hair. They're like, Mom, where are you? Not Dad. 1, 2, 3. Let's swing your legs this way for me. Good?
Yes,
okay.
I'm good.
Awesome.
Thank you.
Thanks for
so
watching.
much.
And if you are interested in perinatal care, go talk to your OBGYN. Ask if there's a chiropractor in the area that they would recommend. That's a great starting point. And I think that the ones that focus on that will have those relationships kind of built out, and that trust and understanding of like how we operate and what we do. So it's a great way to figure that out for yourself. Okay, good luck.
Hey everybody, Dr. Angie here, and we have Nicole with us today. So Nicole noticed something about herself the other morning. What was it, Monday morning?
Yes.
You noticed it? Tell us a little bit about it.
So Monday morning, I'm getting ready for work. I'm looking in the mirror and I'm like, why do my shoulders not look the same? And then I noticed that this shoulder is more forward and this shoulder is back like it's supposed to be. And I just thought that that was a little funny. So I said, Dr. Angie, what's going on? Why?
Yeah, why? And so a lot of things play into this. A lot of people notice. I mean, we sit a lot more than we used to. We sit at desks. We look at our phones. But everything posturally does this. And so when it happens to just one shoulder, it can be if you're working at a mouse and that arm is constantly forward, or if you favor that side when you sleep, or even sitting on a couch, if you always lean on the armrest on that side or tucking that shoulder under. So the muscles, especially for long periods of time, like sleeping, you're going to have that tightness come across the pec and the shoulder. And this happens a lot in upper cross syndrome, where the pecs are really tight, the upper traps get really tight. So when that shoulder comes forward, these muscles get really tightened up here, and then that kind of prompts our head to jut forward as well. So what we're gonna do as far as how we treat this in the office, we do a little soft tissue work. We can do some ART. We're gonna get into like the pec, more on that right side, but we're gonna get into the pec, and I'm also gonna work around the back side of the shoulder, and we're gonna get her adjusted. All right,
Yay.
Let's do it. Let me have you start out face down for me.
Okie dokie.
And leaning down. Whee. It always goes so much slower than I want it to. All right. And how much this girl's running around the office, doing all the things, grabbing charts, pulling people into the back, getting ice packs, heat packs, all the stuff, doing lasers. Oh my gosh, leaning over and doing the laser, that'll do it for sure. So you got a lot of that upper back tightness and into the upper traps. If you want to zoom in on it, you can see this knot that I roll over in her upper trap. Ready, and roll. That guy right in there. So we're going to work into that when she turns over, but we're going to see if we can get the mid-back moving here for her. We got a lot of restriction here lower in the mid-back as well as up high. Go ahead and take a breath in and breathe it all out. Good, one more. Oh, very tight. You might actually do better with your laying face up for this one. So I'm going to have you roll over for me.
Cool.
Whee. So different way that we can get the mid-back to move instead of just pressing on you. I'm going to have you give yourself a nice big hug, arm over arm. We're going to roll really tight here. Roll with me. Take a breath in. Bring your chin to your chest. Breathe it all out. Good. There it is. A little one up high. Cool. And you can relax the arms.
Yay.
So I'm going to borrow this guy. We're going to work into the pec. And under the collarbone right in here. So we're going to do a little stretch. And back.
Ooh.
Yeah.
Whoa.
We're going to do kind of broad contact here, working through the shoulder. Now it'll feel a little uneven because we are only going to work this side since this is the side that is more prominently forward. However, this is something like as far as a stretch, we can work into a pec stretch, which is like that wall stretch where you have your arm up and then you step through and trying to just step through this area, stretching through that shoulder. You could change the angle where you go more low. Good. Working mid. As well as up a little bit higher. Different angles of the pec. Think of the pec as like a fan coming across, so it attaches to the sternum and fans out towards the outer side of the shoulder. So everything wants to roll in and internally rotate, so we want to get things open right in through here.
Ooh.
Little sticky, little icky, but it's okay. We're going to work through it.
One.
Good. We're going to get one more here, a little pass, and kind of bring the arm back and down. Good. All right. And we'll get the neck adjusted too.
Yay.
So we got low on this side, a little bit higher up on this left side. I'm going to go the high side first. Let it rock with me. Nice. A little stretch. Good. Same thing over here. Good. Nice and crunchy. Good. All right, and that is one of the ways that we adjust and we work on that upper cross syndrome, especially when it's one-sided in the shoulders, getting it to relax down a little bit more. Now, may not go away all in one treatment, but definitely feeling some looseness in that shoulder is what we want. All right.
Yay! You did it. Thanks, Dr. Angie.
You're welcome.
I can fly away now.
Welcome back. We are using FlexBone. It's locally made, and there'll be a link below for that, along with his link, maybe another link. I don't know how many links we're doing, but that stuff's really good. It's like a muscle balm. It has capsicum, menthol. It has CBD for anti-inflammatory effects, and it's got essential oils as well. I'm more on the understanding that the analgesics are just good for general achiness in an area, and it's really good to apply this stuff, especially prior to movement, because it just makes you more likely to kind of provide quality movement to that area and like get over the hump, if you will, like soreness, tension, pain. Because movement is very therapeutic. We just sometimes have a hard time kind of leaning into it when we're hurting. So that's that stuff. That's FlexBone. Colin, you can use it on your shoulder before you go play. It'll help quite a bit, especially if you have like compression sleeves. Man, what I used to see the pitchers use for the Orioles is they would use tire balm. It's the same thing. It's not the same thing. That's probably, I would say that's better quality. I feel like it lasts a lot longer. But a lot of different products out there, and they would put a bunch of it on, and then they would put their sleeve over that stuff, and then go throw and warm up. And it probably felt like their arm was like 1,000 degrees, but it allows them to put some velocity on the ball quickly. All right, bring your knee up to your chest, and then bring it behind you, and extend, and then relax, and extend and relax as you do that. Let your leg drop. I'm gonna guide you. You okay?
Yeah, just tight.
Yeah. Bring your knee up again. And again. So with these ones, let's just do like a fast forward. So that would be in the middle of that fast forward. Alright, let your leg drop. And then really let it fall.
I mean, I'm trying.
Bring your knee up.
Oh, man.
You're good right there. Hang that for 5, 4, 3, 2, 1. Go to a comfortable range. Go back. Let's bring it up. Right there, I want you to try to squeeze your knee to your chest as hard as you can. Maintain it, push your elbow into it as well. Bring your elbow to your knee. Push together. For 5, easy. 4. Maintain your back, good shake. 3, 2, 1, relax. Extend both. Just get long through the heel. Long through that heel, straighten your knee. Come on, you're back.
Oh, man.
All right, buddy. Did you go to the block party last week?
I did not.
Me neither. We gotta.
Looked like there was a lot of people that went up there, though.
That's good. Are you still kind of helping out with stuff in the community?
Less so. I just don't have any time right now.
Are you busy? Lacrosse tournaments?
Lacrosse tournaments everywhere. Field hockey stuff for the other girl.
So you might not be in Baltimore, but every dad and mom in Baltimore on their weekends in the summer is hanging out on a random field somewhere in Maryland.
That was Father's Day.
Tournaments. Oh, that was Father's Day?
Father's Day Complex.
Was that really? Happy Father's Day. I'll leave it on this. Oh man. Like, and so to put into more perspective relative to that, I guess probably soccer would be the most easiest thing to recognize it locally to wherever you are. But people play in the summer, so they get recruited to play in high school and in college. And for skill development, it's fun. Kids are enjoying it, but it's a big recruiting platform. Release here, relax your shoulders. So I went through that whole routine here. I played for a few years in college. Nice. Line your side, this side up for me. Take your time, Colin.
They had all those tournaments back then when you were playing?
Not as intense at a young age, but like it was what your kids are probably experiencing now. It started around like 9th grade, 8th grade. It was like most of us were doing that. Maybe not as often too. It was more like once a month, not every weekend of the whole summer, where there's just so much competition going on. I gotcha.
Ow, my shoulder's caught on something. Sorry.
No, you're good. Here you go. Is that better?
I think so.
Still good? Oh, seems like it. Relax. Just like that. Good. Come on your back. And then roll on your side face that way. So for Colin, his low back doesn't like a lot of flexion and rotation when I set him up to adjust him. So I just did the other side in a different way, but I'll show you. I keep him stacked in extension and then create lateral flexion down. And he moves a lot easier that way. Just drop your hip for me though. Good. Drop. Good. Come on your back. So you spent the day out in the field on Sunday.
Yeah,
Saturday. That's just for one of them, right?
Yeah.
The oldest is really into lacrosse.
And they played a team from Houston. They played a team from Ohio.
That's crazy.
And they're in like a lower division.
I know we probably have nothing to complain about. They're always traveling down to us.
To Edgewood.
Yeah, to Edgewood.
I mean, like Houston to Edgewood.
I know. That's crazy. There we go. Your shoulder here, okay? Turn your head to your left. Your watch. Reach your muscle and go back. And then when I roll you back, just let it roll. Oh, good. Oh, that's good. Turn your head to your right.
That's a spot that was like
Biting on you in the dry needle, right? Yeah. I'm palpating over that rib head just below it, and it's moving just fine. Easy under there. See, it's that easy. Nice. Easy. Relax your jaw.
oh.
You good? Yeah. That was a good release. I appreciate the trust in me, Colin. Alright, let me get that one spot in your shoulder and then you're out of here, man.
Alright.
Alright? If I keep you here any longer, your kid's gonna be mad at me and my front desk is gonna be mad at me. Don't move, Carly, trust me.
Oh,
look at it,
yeah,
Carly.
no.
You're supposed to just like trust that went in. No, it's okay.
Can't let them.
Nothing, no trust there. Head back for me. Head down. So Colin, thank you for taking time to do this video with me. I appreciate you as a patient and as a neighbor. Head back and what you're doing as a as a business owner too. It's impressive, man. Bring your chin to your chest.
Well, and you guys got a great channel and a great practice. And so it's fun popping in and seeing some of the videos that you guys are doing and some of the newer treatments that you guys do for people.
Yeah, trying to stay on top of it. So we added, I don't know if I told you this earlier, we added primary care. So we've got functional nurse practitioner just joined our team. So we'll be doing
Nice.
IV infusions and eventually peptide therapy, PRP, stem cell treatment, ultrasound guided injections, and right now she's going to be working more on the primary care role because that's where she comes from. But we're advancing into that field. So having a little bit more of a hope, like taking it to that level of holistic care.
Right.
And like-minded individual, lacrosse player, like everybody here. Turn your head to your left. Played collegiate lacrosse at Georgetown. Worked in emergency room medicine for a long time, and then got her NP and has been in the primary care setting prior to this. But she'll be joining our team officially in 2 weeks. She's here today, so it's our first day with her. It's a big deal. Bring your arm across your body for me. You just got to look from Kayla. Head down again. Bring it across again. Right there, I got you. Hit that lacrosse ball and do those 2 motions right on the spot where my thumb is. And just spend like 2-3 minutes loosening it up and warming it up.
Okay.
And then do like, think like cat-cow over the upper spine.
Right.
I've shown you different ways of hitting that space, but your spine here just needs to loosen up just a little bit, in my opinion. And then I think you'll have a really good match.
Okay.
Alright?
Let's just do that on the wall.
You can do those elbow slides along the wall, yeah.
Okay.
Yeah. And a lacrosse ball pushing against the wall. I know, I feel you. Head down though. There it is. Life's good, man. Good to see you.
All right.
Hey everyone, Dr. Angie here. We got Bella. We're dealing with some back pain, more so on the left side. All right, we got some mid-back stuff going on, so we're gonna check it out. We think we might have some rib fixation going on. How long have we been feeling it?
Yesterday, this morning.
Yesterday, okay.
Yeah,
So
nothing
not like
crazy.
we've been dealing with it for a week or something,
No.
but just the leaning over, bending,
Yeah.
reaching,
Oh,
picking
with
up
the
a
kids.
kid.
Yeah, you know, the little finger.
Hand holding as you're walking around
Yeah.
with them.
Spend a lot of time in this position.
We don't want to end up like that. All right, let me have you go ahead and lay face down for me.
Meow.
And you got the armrest up by your side. There you go.
Dun, da, da, da.
And you get all the beautiful, luscious locks out of the way. There's something already.
Ah.
Yeah.
Yeah, you
Right
feel
in here?
it? Yeah.
Okay. Not a ton of low back stuff going on, or just tight as usual?
Just tight. I do a lot of bending.
You do.
The whole spine is not happy.
All right, I'm gonna do a little lift with your hips here. One hand on the front, little lift and twist. Good. One more. Good. A little bit of the rib, right? All right, we're gonna do that same thing on the other side.
I love those ones. They're so cool.
Right?
You're like the only doctor I see that does this adjustment.
I think I'm the one that kind of introduced it to him. There it is.
Ah,
Yeah.
I love that one.
Breath in for me here. And breathe it all out. Good. Yeah.
My neck's always got a lot going on.
Go ahead and let your head kind of rock. Flip to the side. Maybe rock it.
Ah.
Yeah, you got it on the other side too.
So nice and yummy.
There it is.
Whoa. That was a good one.
That was a good one. All right, I'm gonna bring you on up. I'll have you turn over. Actually, go ahead and lay on your side facing me. We're gonna get the lower back too. Cause
Woohoo!
you need it.
Because why
You
not?
need it.
You never, no reason not to. Might as well.
Slide a little bit closer. Perfect. Breath in for me. And breathe it all out. Good. Nice. And
Such
the
a
other
cool
side.
low back adjustment. So cool.
You're quite crunchy.
You are crunchy. But
Oh, I know.
It makes it better for videos,
I
right?
love that I'm crunchy.
Breath in. And breathe it all out. Good.
Oh,
And flat on your back.
so cool. People watching are probably like, how does she do that? I don't know.
Yeah. It's
It's
magic.
all in the flick of the leg.
Oh yeah. How's that feel?
Yummy.
Yummy? Okay.
Yummy.
Does it radiate anywhere? Not getting headaches or anything?
No.
Tension there?
It hasn't moved yet.
That's good. You don't want it to move.
No. I do soft tissue like pretty regularly
Good.
throughout the night. So it moves better.
Oh, I like the pearl earring.
Oh,
that one's
thank
cute.
you.
I like all of them, but that one got
Pearl
me. I was like,
specifically.
ooh, yeah.
Stretch those traps.
Yeah. Oh yeah.
Oh yeah.
Felt that one?
I did. Nice. Art 2.0.
Right? All right. Little adjustment here. Let your head rock with me there. Good.
Yummy.
And lower on this side. Good. Extra crunchy. All right. Awesome. All right, we're gonna go for this one first. Honey.
We're doing a wraparound?
Yeah. Let me get this in the pocket.
So let's not stab you with the ring.
Yeah, I was like, no stabbing you or the table with the ring.
Table will be fine.
And breathe it all out. Tiniest bit. You
little
might have gotten a lot of
baby.
that on your when you were face down. Same thing over here.
I think I move better face down than my ribs.
Yeah. Go here, breath in. And breathe it all out. There it is. Nice.
That
All
was
right.
nice.
got
Thank
'em.
you.
You're very welcome.
Now I can bend and move all day.
All right. Awesome.
Nice.
Feeling a little looser?
Yes, thank you so much.
Bend down. Do you feel that pull in the rib?
No.
Wonderful.
That's awesome.
Yay.
Thank you. Oh my
welcome.
goodness.
Good morning, everybody. This is Dr. Warren Kalkstein here with Robert, a veteran that comes to see us in our office. I wanted to share a little bit about the program with Community Care. Before we get started, thank you for your service in Vietnam. 1 year, 10 hours, and 5 to 8 minutes.
Close.
Happy to see you in the rearview mirror when you left, I'm sure.
Yes, oh yeah.
Robert and I go way back in terms of working with each other. He periodically through the year gets referrals over from his primary care at the VA, and he goes through a program called Community Care. Our office is a part of that program where when he comes over, I have access or I'm able to give and provide care for Robert, including shockwave therapy, physical therapy, massage therapy, chiropractic care, soft tissue work, etc. So it's a really amazing program, and we've got a great relationship with the VA in that. And you can probably speak to that. I mean, Robert, in the process, he does research for a living and writes books about all kinds of events, especially field hockey. But in the process of going through and getting referrals over here, you've educated me along the way of what they look for, how to help other veterans in the community. So I'll let him speak to that. I'm going to work on him a little bit while we catch up. But if you are a past patient, or if you haven't heard of us before, and if you would like to receive services from our office through the VA, you can go through your primary care. It's a process, but it really does allow you and give you access to a great team here in Towson. Okay, I think I kind of covered the bases on that one a little bit. Anything else you'd kind of add to that relative to your experience or what you would recommend?
Well, it's a changing playing field. It used to be you simply would request through your primary care that you wanted some special services. The primary care would make a console and request that you get those special services. Unfortunately, during the years just before the pandemic, there was a lot of abuse of the system, and the system went through a complete change in the years 2019, 20, and 21. Now you still make a request through your primary care physician, but the request goes through a series of approvals. as many as 3 or 4. It used to be that you could get up to 10 to 12 appointments. Now it's pretty much 8 appointments. I would suggest that if you get approved through community care, that will provide for you some really special things that Warren does and the rest of the team do here, that, let me tell you, that extra service that you can get makes a difference. I can feel it. But when you go to schedule your appointments, use some thought behind it. Don't try to schedule and bunch everything together in 1 or 2 month period of time, because that's not going to get you the results that you want. Plus, community care is going to be watching how you use your appointments.
Yeah.
Schedule
Yes.
your appointments over a 6 or an 8 month period of time, because that's the time period that community care is going to give you. Use the process. Accept the protocols. They will have an impact, and if you do it in that manner, the next time you apply at community care, they're going to be more apt to approve you in maybe 1 or 2 approval process steps than 4 or 5.
So there's a couple of things that we've worked on with Robert, right? He's had injury in the war that's sustained over time in terms of an IED explosion and things of that nature that have caused some chronic lower back, discogenic, arthritic type pain that refers down his leg. So I treat him for those issues. Recently he came in with a different referral relative to a rib aggravation. So he ruled out cardiovascular issues, went to pain management. They kind of agreed with the treatment plan that we were doing, and we've been doing soft tissue work and adjustments around his mid-back where he had that irritation. So what do we help with? Musculoskeletal issues of kind of a lot of different nature, whether it's plantar fasciitis or whether it's a disc irritation or a pinched nerve in the back, right? And then I know there was a lot of information relative to the administrative side of things, but we'll help guide you through that. You don't have to remember all that, but that's just a really good understanding that he has is people abuse the system in the past, so it's privy of you not to do that going forward. And we don't schedule people out that way. We don't want to use all your visits up unless it's clinically necessary, and we require to get you in here a little bit sooner. Then we'll definitely do what's best by you first, okay? So as it relates to what we can help with, those are some of those things. How you go about the process, I hope you understand that. And some of the services and the therapies that we offer here, I hope you have a general understanding. So if you or you got somebody in your life that hasn't really followed through on something, or something has been sustained over a period of time, I see those type of problems all the time. And I think that we can really provide some breakthrough pain relief with some of the additional services that we're able to create and provide for you, and just this awesome team here. So I would love to help you out. I really appreciate the people that we get to work with. We have a great group of patients in here, but it's really special when we get to work with veterans. Our family, a lot of people in my family have served, so it's my way of kind of keeping attached, if you will, or supporting that community, and grateful to be able to do that. I've had past experiences in a setting with working with active duty at Walter Reed, where I did my preceptorship. So I have a general understanding of kind of the workups that people go through the VA system, through the military hospital system, and I just would like to continue to do so in private practice here in Towson. So, like I said, I happily invite you to come in. Grateful to get to work with you. All right. So I'm going to do some soft tissue work, some pin and stretch, some massage on his shoulders and his neck. I'm going to adjust his neck, but I wanted to share that with you. And we've already kind of worked on his mid-back, his lower back. He's just getting adjusted today, but when he gets that referral over from the VA, we'll be doing more therapies and services, and maybe we can share some of those potentially when you come in the next time, if that's okay with you.
No, that would be fine, because I'm walking proof that it works.
Yeah, we really had some fun success over the last 6 months with something that's been going on for 30 plus years. Yeah. So it's not, I would say don't give up. I'm pretty competitive on dealing with problems like this. So, and grateful to get to work with you, Robert. Okay. Genuinely, thank you, and I appreciate your service, everyone that's watching. Awesome. Go. So. There are a lot of muscles in the base, like a lot. surprising amount to create all these facial expressions that we have, and so I'm going to be doing some work on some of those muscles. Right? And then I'm also going to be working on some sensory points that will cause reflexes to help with some range. You can do this on your own very easily. And I usually tell people in the allergy time, it's like, you don't just have to take Allegra. There's other ways of working on some of those things, and this is one of them. Oftentimes I'll just help people get like a really kind of intense, like, just get face wash and then just work these areas out while you're in a hot shower. It's like a great time to do some self sinus massage, relaxing. Gentle lymphatic work before I get into prepping the next sinuses. My oldest is like 3 now. She's starting to request like she had great. She must be working on her neck and stuff like that. And her awareness is actually like surprisingly good. Like she's like, Dad, the right side of my neck is feeling a little tight. And I'm like, okay. Like she just like kind of get me to work on her, just like kind of get an attention. I'm like, oh my gosh, actually the right side of your neck is actually just a little bit tight. You're not too far off on that. I've given lots of baby massages recently, like a ton. And they love it. My 11-month-old, I'll like to massage her back a little bit while she's like falling asleep and just kind of gently work on it. And like connect everything. Lips together, teeth apart, flip the tongue to the roof of your mouth in there. And it just relaxes. There we go. Gently open your jaw. Go, 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 go. Good. And relax. Gently open. This is Flex Balm. Carly, we tag it. It's good stuff. Don't get it in your eyes. second, but first I'm gonna work on your mid back, okay?
Okay.
Let me get you the tissue. Normally I talk a lot in videos and explain what I'm doing. I'm just not doing that in this video. I'm just trying to give her a relaxing experience, so that's why I'm not speaking a lot. You're welcome, of course. You can relax on your stomach here for me. This is like the soon-to-be newlywed experience. We're just trying to relax, okay? We've got enough things going on, alright? Don't need to worry about, you know, the YouTube video in the back. We're just here, okay? Scrubs. These just, you can't move in these things. You need to go back to the underarm. Feel that stress. Take a deep breath in for me. Exhale. And easy out. Rest your shoulders. Relax your head. Let that pressure fall. Good. Good. Easy. Nice. There you go. Nice. Good.
Yeah.
Awesome. You can sit right there for me. So you're in occupational therapy now, right?
I am.
What hospital are you working at?
University of Maryland.
Nice. What population?
I see adults in the psychiatry unit.
Do you? Good for you. Turn left for me. Turn right. Stand. Good. You move relatively well. We'll work on that right there, okay? Pressure. Good. Settle your shoulders. Good job. Be gentle on this side, okay? More gentle. Just pressure. Pressure. And settle. I got you. There's the release right there, okay? Tension. Easy. Gotcha. All good?
Yeah, it feels much better.
Wonderful. I hope you have a wonderful day. I really appreciate what she does, if you can't tell already. And it's cool. We have really good patients here, fortunate. But yeah, sometimes people are hurt and they're in pain. It's hard to work with them. She's a joy to work with. Like, it is an absolute pleasure to help her out. So I'm so excited for her future. I love the connection to the office with some of our past employees, Dr. Alec and her. We're friends at Towson, and we've got like to appreciate his smart ways and his ability to understand the topic and go into it. So we were talking about that last time, but yeah, so grateful to work with you. I hope you feel better.
Yeah, thank you.